morning. Good morning to everyone. We are still working on some technicalities on bringing the panelists on board, so just bear with us for a little while.
Tina, are the panelists able to join, or are they still in process?
I see some of our panelists. Maybe the panelists can already share their video, so we see that you are all right and that you are able to hear and see us. For everybody else, we're working on adding all the panelists, and then we get started. All right. Good morning, everyone. At least a very good morning to everyone who's joining us from the Africa region and the European region. I know for some of you it is a quite late early show, and for our colleagues in the Asia region, it's already midday. We've been working on some technical issues, and I think we're still trying to add the co-host, my co-host from UNICEF. But I think we also don't want to let you wait much longer. And I was hoping to see the presentation now. Is it possible to bring that up?
Who is sharing the presentation?
Christina is supposed to share it, or someone from my...
1 second.
It's coming.
Okay.
Sorry, everyone. Thank you, Linda. So I think in terms of presentation, we are set. Maybe I'll just start by introducing myself. My name is Tina. I'm a WASH policy advisor with GIZ in GIZ Head in Germany at the moment. Before that, I worked for quite some time in the WASH sector in Uganda, and I'm really happy to already see some familiar faces here in this early show on the Africa region. As these shows are intended to be a little bit more informal and give us the opportunity to exchange on the content on the conference through a regional perspective, I think we just get started and I really hope that my co-host Farai from UNICEF based in Nairobi is able to join us at some point. Otherwise, I think we have some great panelists here who should also be able to exchange some thoughts, even if they have to bear with me for the moment. Next slide. As you may have seen in several slides and on the agenda, this conference this year is also co-sponsored by the German Development Corporation, and one of our directors on global health, pandemic prevention and One Health, Birgit Pickel, has sent a greeting message to all participants. We just took out one quote. If you're interested in reading the whole message, you can just click on one of the logo sets in the agenda and you will be guided to the booth where you can find the whole message. Next slide. A few things on the general conference. For those of you who have missed some of the very interesting sessions in the previous days or may not be able to attend all the sessions live, also due to the different time zones, you can always re-watch recorded sessions. And one service is to just click on the agenda and on the session itself, and you will be able to watch the recording. And in future, you should also be able to access the sessions through YouTube, through the YouTube channel of UNC, which I think is a great service that also should broaden again the base and the number of people who have access to the valuable information and thoughts of this conference. We are also encouraged to join the mingling and the meet and greet function on Remo. My understanding is you can click on the agenda meet and greet and then access Remo by registering for it. And there you can sort of find a virtual roundtable setting where you can meet different organizations and representatives from different organizations. If you show the next slide, then you get an idea on what that looks like. And with that, I think we're ready to enter our session. Can we go to next slide? Is Farai in this call by now? That is very unfortunate.
I think that there's a problem with the firewall, so we're working on it.
Okay, then I'll try to run this show on my own, which I wasn't prepared to do, but I'm very happy if the panelists just come on board. Would you switch on your cameras as panelists so everybody can see you? And I think we start by introducing you, and I think we can just start with Najib, who was a panelist on the first plenary panel and is a WASH expert joining us, I believe, from Kampala still. but has in the years that I've known him worked around the globe on sanitation topics. Najib, what is your background and why are you so much into the sanitation sector?
Thank you, Tina. Good morning, good evening, good afternoon, wherever you are. And thank you for the invitation to this panel. Thank you for joining. My name is Najib Bukoya Bateganya, originally Ugandan by citizen. So my background is in environmental engineering. And I have been, like Tina mentioned, working with colleagues and partners across the globe on this, in this sector for the last about 15 years now. In the past about 10 years, I worked a lot on urban sanitation and wash programs, specifically in Kampala, designed a very, we are part of the team in Kampala that initiated the citywide inclusive sanitation approach, and working with colleagues across Africa with the Africa Water Association, we've been able to spread this campaign across cities in West, East, and Southern Africa. Currently, I am a lead expert on the citywide inclusive sanitation initiative, technical assistance hub, which supports donors and governments in designing and implementation support for citywide inclusive sanitation across Africa. So this initiative is funded by Bill and Melinda Gates Foundation, and we are currently working with Africa Development Bank, World Bank, Islamic Development Bank, and so many other partners to make sure that CIWISE, or citywide inclusive sanitation, is integrated in urban wash programs. For now, I think, Tina, that should be sufficient. Thank you.
Thank you, Najib, and thanks for joining us in this late early show on the Africa region. We also have Musa Manga joining us, and I think you two also had sort of touched on similar aspects in the question of how sanitation and hygiene need to also look into the pathogens and the question of pathogen monitoring when we set up sanitation sectors. Musa Manga joins us from UNC itself, so I'm assuming that for you this time is very late in the evening. Thanks for joining us. Could you give us a brief insight into who you are and what makes you so interested in our sector?
Thank you so much, Tina, for inviting me to this panel. My name is Musa Manga. I'm a researcher at the University of North Carolina, Chapel Hill. I am a sanitation and environmental engineer with over 10 years of experience in professional practice, fundamental and applied research on WASH. And I really work on environmental engineering challenges in quite challenging environments to protect public health and well-being. So my research focuses on planning, monitoring, improvement of sanitation and fecal sludge management practices in the Global South, especially the marginalized communities, to promote equity and inclusion in access to safely managed sanitation, development and validation of pathogen hazard and risk models, environmental justice and climate change mitigations. I also look at identifying low cost and scalable interventions to interrupt transmission of excreta-related diseases and fecal sludge treatment. So I have really worked on several projects in urban Africa and South Asia that evaluate fecal sludge management and treatment. And as I speak right now, I am leading a project on pathogen flow in communities in South Asia that is funded by the Gates and Melinda Foundation. Thank you.
Thank you so much. And we have another participant joining us from UNICEF. Unfortunately, I think my co-host from UNICEF Nairobi is still not in this call. If you are, Farai, then please interrupt me. Otherwise, I'm happy to also introduce our colleague from UNICEF joining us today, Irene Imogen. And I think you are really coming in also as a specialist on one of the topics that was raised in a lunch session yesterday. So the whole aspect of WASH in schools, safe reopening of schools in the times of this challenging pandemic. Irene, would you like to introduce yourself to the participants and also mention a few things about your background?
Thank you so much, Tina. Good morning, everyone. Good afternoon, wherever you are. My name is Irene Amongi, like Tina mentioned, and I lead UNICEF WASH in Schools program globally. I'm based in New York HQ. I've been leading this program for the last 5 years now, and we work with governments around the world as well as partners to improve WASH success in schools. So I'll try to be brief because I can see that we're already into 20 minutes into the session. So my motivation around, I think, Farai had asked about motivations for our role on this subject. And first of all, I want to say that water, sanitation, and hygiene are first of all children's rights. And I think it's all important that we all ensure that school children have access to these services. But also WASH services are important for the well-being of children, as well as providing a safe learning environment in school. So I think it's good that we have so many partners involved in this area, and we are happy to connect and collaborate with the different partners around the world to ensure that we can provide safe learning environments, that the children have access to these services to fulfill their rights as enshrined in the UN Convention on the Rights of Children. Thank you so much. Back to you.
Thank you. As this session is sort of about our takeaways and raising a little bit the attention to a few points that have been discussed, I would like to sort of look at the first day and the questions on sanitation and on urban sanitation as well as rural sanitation, and how the sanitation sector and the health sector need to come together to improve the safety of sanitation services and increase the provision of safe sanitation services. Najib, would you be able to give us a few insights on what your main takeaways were from the plenary session on Monday and other interesting aspects you've looked at during this conference so far?
Yes, thank you, Tina. And I see a colleague from World Health Organization, I think is part of this, and we were together on the panel. So I think she can as well share some insights later if possible. But yes, it was a very interesting panel. Just to take you through, so we mainly looked at about our discussion was structured around 4 key areas. So one, we reflected a bit on what actually safely managed sanitation means, because we talk about this, and definitely I know most of us are familiar with the GMP sanitation ladder. So this and the SDG definitions, and this clearly define what safely managed sanitation is. But for purposes of takeaway and emphasis and clarity, we emphasize during the discussion the focus on making sure that whether on-site or off-site sanitation, the human excreta is safely managed and disposed and treated. with attention to aspects of public health protection, so prevention of pathogen flows into the environment and breaking, creating an environment where there is limited contact by humans to the fecal waste. There was also an aspect of human dignity and privacy. So sanitation that emphasizes human dignity and privacy and safety. I heard you talking about sanitation in schools for our children, for the vulnerable people, elderly, and also making sure these sanitation facilities are not just focusing on the infrastructure, but also the social aspects around them. So we also emphasize the fact that we do not need to look at the toilet as the end, but the entire sanitation value chain. So thinking about safety, we don't stop at the containment, but also the collection and transport for on-site sanitation, and the sewer systems and up to the treatment and end use. The second part that we reflected on was, where are we in terms of safely managed sanitation? For this particular question, we generally reflected on the World Health Organization and UNICEF statistics, progress, the status of sanitation, global sanitation currently. And we noted that there has been some progress, especially on the safely managed sanitation since 2000 to 2017. We looked at some of the figures, and you note that in 2000, we were at 1.76 billion people accessing safely managed sanitation, which represented 28% that time. And by 2017, we had achieved 3.648 billion people getting into the safely sanitation management and safely managed sanitation service ladder, which represented 45%. So this was a bit great, but we also recognize the fact that we have major backlogs. And since this is an Africa session, we note that sub-Saharan Africa specifically is lagging quite behind. So when we talk about doubling or quadrupling effort, we need to do more, ending open defecation, translating from unimproved to safely managed facilities in both rural and urban, and also addressing the issue of shared sanitation in the urban environment. So that brought us to the third issue, and that is, how can we really fast track this? And from the discussions, I reflected on a few issues that are applicable for the Africa region. One, to note that, yes, we can do it. We can make it. There are solutions, there are technologies, there are innovations, but we need to scale these up. We need to trigger impact to scale. So all these small pilots and innovations in terms of technology, demand creation, private sector participation, rural sanitation improvement initiatives, they are success stories scattered across the region, but we need to take them to scale. And how do we do that? Most importantly, we need to catalyze the political will, the governance and policy issues. So in all these initiatives, governments must be made accountable. They should take responsibility. and we should provide these pilots as evidence, data as evidence, to try and inform policy, to try and trigger government commitments to make sure that we scale up these initiatives. So the other one was, of course, trying to make sure that we use evidence-based planning and investments. So we need to improve quite a lot of evidence in terms of data, in terms of available information, status, also including the social and economic context, taking into consideration the social and economic context to inform decision making. So we realize that some solutions work in certain contexts and others don't work in other contexts. So it's important to be context specific, and this is where evidence comes in, and innovation and models, to make sure that before we scale up, we know these have been tested and can work. Bringing women in the lead, especially African. So championing women, making sure that we also look at innovative financing and private sector participation. The last bit that we looked at is, in summary, what can we do what have we learned over all these years, and how can that help us to take off? So we learned that, first of all, one, there are already solutions that are working, so on ground. So we need to use, like I already mentioned, evidence, data and information that is available in terms of service coverage, in terms of service quality, in terms of existing solutions across the entire sanitation value chain in both rural and urban, and trigger investments from both local resources. By local, we mean government, and also donors and private financing. The other part that we looked at was we need
Najib?
to. Sorry.
Sorry, I'm sorry. I would just like to also bring in my co-host. You mentioned women, and I'm very happy that we have another woman who's able to join us after some technical difficulties. And I would just like her to also introduce herself and join us in the discussion. And I also I didn't mention it explicitly, but I encourage everyone in this call to join us on the chat function on Pathable. We sort of can bring you in when you write us some questions or remarks in the chat, and we will then repeat them for the general audience, or people can reply to them in the chat. I think that is sort of the best way to also join the discussion if you are not an assigned panelist today. Farai, good morning, great to see you.
Yes, Tina, it's great you have been holding fort and really have managed to stimulate the discussion. Najib, it's really wonderful to hear how we are moving from looking at the problem, but to understanding it, really coming up with pilots and solutions, and then now looking at the next challenge around scaling up all of this. Najib, just reflecting particularly on your introduction, I noticed that you do work under the CWISE Technical Assistance Hub. How does that hub actually help us as we deal with the challenge of scaling up? And how can the different governments that you've alluded to and other partners actually access some of the support under the hub that would help us to be able to scale up and really respond to the challenge? Over to you, Najib.
Yes, thank you so much. So from working my experience working in Kampala for over 10 years before I transit to the hub, we learned quite a number of lessons. And this is where the citywide inclusive sanitation comes in. So we noted that over the past, there has been a lot of focus on infrastructure and investment in sewers. And over the years, we see we are not making progress on access to safely manage sanitation. So we are focusing on a few, mainly, especially in the urban. So the few connected people are the high income, and then you have less focus on the low income communities. So this leaves us with almost less than 10% of people connected to sewers, and almost less than 50%, of course, people connected to safely managed sanitation. So the Seawise approach focuses on 3 key outcomes of sanitation investments. 1, equity, making sure that everybody benefits from the services and the infrastructure investment. 2, safety, and making sure that we do not just put infrastructure or solutions on ground for people to have access, but making sure that what we put up is encourages safe management of human excreta along the entire value chain. 3, sustainability. So making sure that the investments we make are sustained by the existing local authorities with clear mandates, clear responsibilities, clear financing mechanisms, and accountability to make sure that this is not just a one-off investment, but going forward, we are able to sustain them. So the Technical Assistance Hub is an initiative of the Bill and Melinda Gates Foundation. And the idea of the hub was to support donors and governments to try and design programs that are responsive to the citywide inclusive approach with the 3 outcomes that I've just mentioned. So what we do is we receive, with this fund from the foundation, you receive requests from either donors or NGOs or governments to support where they are, especially in project or program preparation to bridge some of the gaps. And what are some of these existing gaps? 1, for example, technical studies. So many people are able to finance, but some of these large scale programs lack evidence and data and detailed information to let these banks or investment partners or governments invest in these programs. So what we do is to actually catalyze the actual investment. So unlocking financing to the ready projects that are well prepared, well designed to respond to those outcomes. The second is, of course, capacity building. So we are able to support governments, donors, development partners to build capacity in this area of Seawise, so that we reduce the number of projects that have been failing over time, so that we change from the conventional approach to the non-conventional innovative approaches that take care of everyone. In summary, the intended outcomes is to achieve 1, many programs that address equity, safety, and sustainability in sanitation.
Wow, Najib, thank you so much for taking us through the benefits and the fact that we do have the skills and the capacities sitting with us on the continent to really raise our capacities in that area. Maybe moving on to Musa, who now talks to us about why it is really important to contain to contain our fecal waste and the benefits thereof. Musa, over to you. You had a very interesting discussion this week on pathogen flows associated with sanitation. Could you please take us through what some of the key discussions under that panel were, and what some of your outcomes were in that discussion? Musa, over to you.
Thank you so much, Fry. We actually try to talk about pathogen flowing communities in our side event. And this comes from the fact that, as we know, UNICEF and World Health Organization actually adopted one of the indicators of safely managed sanitation services, which is actually great. And this looks at safe management of human waste from containment to the disposal stage, so all stages of the chain. And it has really done great in trying to know how can we track access to sanitation in communities and how to improve access. But then from the public health perspective, we believe pathogen flow is really important because that will help better decision-making by knowing where are these pathogens flowing in and where are the exposure pathways and how can we intercept these to minimize on, people getting, these diseases and so on. So for that reason, we're trying to advocate to look at pathogens flowing in these communities and trying to look at these exposure pathways and how can we intercept them. So in our side events, one of the presenters was looking at, can we look at mass balance? And that was looking at the MAPSAN project, and they're trying to look at the mass balance of pathogens in communities, asking themselves where are they coming from? And we're trying to do the track back of all these pathogens. And what they end up showing was, it's not about fecal sludge management alone. There are other things like child feces disposal is also one key thing that we forget about in compounds, that people have good practices of non-disposing or unsafely disposing of child feces. And as they dispose them off, they get up into the environment. And that's one way to expose this. Another presenter, that was me myself, that I was trying to talk about now the containment systems. We looked at the project or evidence we did in Tamil Nadu, India, and we wanted to know where are these pathogens flowing. So what we had to do is to understand what kind of systems do they have. So we had to open their, containment system in the ground, try to assess them to know if they are actually having open bottom, permeable walls, fully lined. If they claim they have septic tanks, they really have septic tanks. And what actually we found was, one, they don't have septic tanks as they claim. They have a different kind of, complex kind of infrastructures they have actually put under the ground, whereby they have tanks overflowing to open drains, tanks overflowing to streams, tanks overflowing to open ground. As they have got a sewer system, which is really great. They've actually expanded this sewer system to quite people in town, and that was great to celebrate about. They had actually direct discharge pipes, but when we started to really examine pathogen flow happening in these communities, what we realized was that liquid discharges from these containment systems contained high pathogens. They were releasing more pathogens. They were concentrating on other aspects and they forgot about that. And we realized that the liquid pathogens discharged in the liquids, they are 63 times higher than what is discharged in the sludge. And what we went forward was, can you please not ignore this liquid discharge from this containment system? And even if fecal sludge management is important, in your case, as you focus on fecal sludge management, please also look at the liquid discharge. Another thing we also found was that the sewer systems they had, the overflows that they received, maybe due to blockages and releasing this sewer to the environment, we realized that they were discharging high pathogen load. And we told them, you should not focus on extending the sewer to everyone, but also look at operating and management of these sewers. Because if you just extend them without operating them the right way, you're releasing more pathogens as well. That took us to another discussion, which was interesting, that came in from one of our group, MAPSAN, that they did something about Salmonella typhi, and they're trying to really track it out in India, Calcutta, and they're trying to look at different types of wastewaters and detecting them. And they realized one of the things we should worry about now is the detection methods of these pathogens. You may end up detecting and say, we can't find it, but what method are you using? So that was another discussion that came in to look at, what are the exposure pathways in there. In their work, actually, they found that one, they actually detected a lot of instances of Salmonella typhi in water, but they could not track it to know what are the exposures, but they still advocated for, vaccination of kids in Calcutta. The other discussion we had that came in from our collaborators, our group from the University of Sydney. And they were looking at something we're looking at similar, looking at how are these systems working. And they talked about a systematic approach to fecal sludge management and containment systems, which really worked well. Summarizing this session, what we realized was one, there are quite mechanisms that are responsible for inactivation of these pathogens in containment systems that are still unknown. And therefore, we're advocating for more work in the sector so as to know how better these systems are performing before we start, advocating for them. Another thing we also realized that detecting pathogens flowing in the environment are really hard and complex because there are a lot of things that happen and, mechanisms and other kind of exposure pathways. From the policy perspective, we understand we actually had to discuss about how do we translate our results in a manner that can help a sanitation practitioner or policymaker make the right decision. And right now at UNC, we are advocating for the pathogen flow diagram. And this would help on prioritizing decision, sanitation interventions to really, improve access. To summarize it all, we actually end up saying that one, we need a robust sampling strategy so that we can have comparable data and reliable data, and also try to see how we could follow up the microbes, the microorganisms, to better inform decision-making and know where are the releases. Thank you so much. Back to you, Freya.
I think, Musa, this is clearly a very important scientific discussion that you've been having. But for other listeners who might not really understand the science and why it is so important for us to follow the pathogen path, why is it really important for us to understand this, and what benefit does it give to people from a public health perspective? And also just to hear from you, in terms of our own context here in Africa, do we see similar challenges like what you saw in India? Over to you, Musa.
Thank you so much, Freya. So the main reason, if I take back a step and look at why do we look at sanitation? The reason why we have sanitation is try to intercept people's exposure to fecal waste and the pathogens in there. And what means in that it's not about safely managing fecal waste. The most important thing in there is what are the pathogens in there? If you try to look at the sheet flow diagram, which is really wonderful, it talks about unsafe return of of fecal waste to the environment. But the most important thing, and one of the things it does, it says either it's safe or unsafe. And we're trying to say, no, sometimes if you look at this, it's going to be unsafe, but the reason is what are the number of pathogens that are in here that could cause a disease to a human being? That it can be unsafe, which is okay, but the pathogens that you find in human waste, which is overflowing from a sewer system, which is really fresh, the pathogens that are still on their strength, is not the same than what you could find in something from, say, a partly lined tank, which has stored it for over 5 years, meaning that within the 5 years, there's been a reduction in the number of pathogens. So someone is exposed to the pathogens in sheet, which is from these kind of systems which have stored it for a long time, to a sewer, which is just conveying it, which is still fresh. It's actually, it's a different way. So we're trying to say the number of pathogens are very key because sanitation is trying to cut off that transmission route, that exposure route. So let us focus more on that. And looking back in Africa, we may not be having systems that are overflowing to the open drain. Some are there, but not so many as that happens in Asia. But we've got sewers, and some people, as you already heard from Najib, we want to focus on providing a sewer system to the people on the the upper side of the bridge. But we know with sanitation is my sanitation does not protect me. So what you need to do is make sure the sanitation is better, because for you may have a better sanitation and have sewer, but where is it going? It's ending up in other communities and passing on more pathogens to them. So sure, let's focus on minimizing unsafe returns from all these systems and the pathogens in by having proper management and operating of them than just extending them. Even containment systems, giving people a community toilet, it's okay, but how do you manage it? Because if you don't do proper management and you have frequent emptying, which is okay, the more you frequently empty, the more you take out fresh content. And if there are leaks, you're actually releasing more hazards to the environment. Thank you.
Thank you so much, Musa. Tina, if you may allow me to continue to take it away. I think no conversation is complete during our time without a discussion around our children, COVID, and what it has meant for us in the past year, how our lives have really shifted. And we now move from the pathogens to a discussion centered around the virus. Irene, I think we would like to hear from you some of your perspectives around getting our children back to school. What has been some of the work that you have been doing, particularly with the Washing Schools Network around getting children back to school and its connotations on water, sanitation, and hygiene? Irene, over to you.
Thank you so much, Farai. So I'll just say a few words about the WINS network, but also refer to some of the work that we have been doing around washing schools. So the WINS network is a global interagency network of partners, including governments, the UN, UNICEF, and other UN agencies, the non-government organizations, research institutes, academia, development banks, private sector, civil society organizations, and as well as donors around the world. And these partners work with each other and collaborate to support governments to improve WASH services in schools. So this network is coordinated by UNICEF, GIZ, WaterAid, Save the Children, the WHO, UNICEF Joint Monitoring Program, the London School of Hygiene and Tropical Medicine, as well as Emory University. So the network has about 5 distinct technical working groups, which are advocacy and policy, monitoring, menstrual health and hygiene, as well as other cross-cutting areas, evidence generation and knowledge management, and program guidance. And the purpose of these groups is really to enable network members from different organizations to engage in areas of interest as per the thematic areas. So we have been doing several things as UNICEF, but also as a WINS network, one of which is really to continue to provide access to basic WASH services around the world for schools that have gaps in these areas, but also providing guidance in terms of developing knowledge products, guidance on safe school reopening. I'm sure that you've all heard about the global framework for safe school reopening, which is really a global guidance developed by UNICEF and different partners, including WHO, World Food Program, UNESCO, to guide governments, but also partners to ensure that all the preparedness is in place, all the facilities and policies and funds are available to safely reopen schools.
Thanks so much, Irene. It's great to see that we have such a big network looking after the young people on the continent. We are actually the youngest continent in the world, and very soon by 2050, we will really be probably even leading in terms of the percentage of young people. On Tuesday, you had a session on washing schools, and you really talked about some of the lessons that you have learned around school reopening during the COVID-19. And your discussion was really centered on the experience in East Asia as well as the Pacific region. Could you briefly just take us through what some of the main lessons learned from that discussion were, and how they could possibly be of interest for us in Africa? Over to you, Irene.
Thanks again. Farah, if you allow me, let me just, I wanted to mention about, how network members or how those interested in the network could engage on WASH in Schools. So we have recently established and launched a WASH in Schools website. It's available online. I think one of my colleagues can actually, or I will provide a link to the website. So this website is a repository of information about what we are doing on WASH in Schools. So different organizations can share information about what they are doing, their reports, publications, and journals around WASH in Schools, but also updates about what they are doing on WASH in Schools. And we also have the YAMA Community of Practice for WASH in Schools, as well as sister platforms such as Susana, which also really engage different partners and organizations around WASH in Schools. We also have global webinars on topical issues as another way to engage. And we have the WINS ILE, which is the International Learning Exchange for Asia and the Pacific on WASH in Schools, as well as the Water and Health Conference, which offers many opportunities and sessions for members to engage and interact on WASH in Schools. But also SIWI, which happens, the World Water Week, which happens around August every year. We always have WINS sessions during that event. So back to your question about the Tuesday event, I'll highlight some of the deliberations by different organizations. So first of all, we heard from the WHO UNICEF Joint Monitoring Program, who provided us an update of WASH in Schools data as per the 2020 report. I'm sure that you already are familiar with the data, but just to remind ourselves, for water, we have 69% of schools with basic access to water, leaving out 600 million without basic water services. For sanitation, we have about 63% of schools with basic access and 700 million children without basic sanitation services in schools. And for hygiene, we have 57% of schools with a basic access to hygiene in schools, 800 million children without this service in most of the schools around the world. So I think the key point to note is the acceleration needed to achieve the SDGs related to WASH in schools by 2030, which is a 7-fold increase needed to achieve universal coverage for water, a 5-fold increase needed to achieve universal coverage for sanitation, and a 4-fold increase needed to achieve universal coverage for hygiene by 2030. And this really calls for us to accelerate our efforts, double our efforts, and increase partnerships and funding to support WASH in schools. We also heard about the disparities between rural and urban WASH in schools, as well as disparities in WASH service provision. And I think from the data, you can see that coverage for water globally is higher than for sanitation and hygiene. So there will be a new report published with an update on this data in 2022. We also heard from Ecuador, and we heard about the steps undertaken to ensure safe school reopening, and a number of steps taken, including a national assessment of WINS to understand the gaps, but also development of guidelines for progressive return to school, as well as an online course for WASH in schools in the context of COVID-19. This course was for teachers, and then a costing exercise to determine what are the WASH gaps in school and ensure that budgets are available to support and to close these gaps. For this deliberation, I think one of the key lessons, or two key lessons that I had were the importance of leadership as being essential for safe school reopening. So leadership by the Ministry of Education, which I think we've been talking about all along, and we continue to encourage and support Ministry of Education to ensure that they provide leadership, because WASH in schools, as I said in the beginning in my introduction, is essential for the well-being of children in school, but also it's important for ensuring a safe learning environment, but also the importance of evidence on the relevance of WASH for safe school reopening, in the case of Ecuador, WASH proved to be one of the essential requirements for safe school reopening to ensure that children can wash their hands and avoid the risk of infection from pathogens. So for Indonesia, we heard about the school readiness assessment for safe school reopening. And this is a checklist which is composed of different items, including WASH service readiness, among other things. This was developed to support face-to-face school learning in schools. I think what struck me about this readiness assessment was the fact that communities and local authorities were engaged to ensure that they approve they approved the readiness assessment to determine the readiness of schools to open safely. For Philippines, they implemented a capacity building plan, which was taken at scale to strengthen capacities of Ministry of Education to improve WASH services in schools. And this included 2 40-hour self-paced mass open online courses on leading WASH in schools and accelerated WASH in schools, which have been essential to improve WASH services and support safe school reopening. And both courses included sessions on COVID-19 as well as infection prevention and control. And then finally, we heard from GIZ in terms of they shared an app that can calculate operations and maintenance costs for WASH in schools, which is an essential tool or app for school administrators to understand what budget implication they have to ensure that these services are maintained. So this app calculates the annual cost for providing WASH in schools, but also estimates future costs and quantities for WASH services, as well as serviceability. So the app provided has proved to be a useful app for budget and planning purposes. So I don't know if you can hear me well. I can see my internet is unstable, but yeah.
We've managed to hear you very well, Irene.
Okay.
And as with the other speakers, we can really see the richness of resources that are available, but also the extent of the challenge. We are counting 600 million, 700 million, 800 million of children in schools without access to water, sanitation, and hygiene, respectively. A big challenge for us, but many partners available through the WASH in Schools network, as well as the other networks that a lot of panel members have also alluded to, and that we have met through the conference that we have been having. Tina, if I may turn to you. Do we have any questions in the chat box? And also looking at my time, it might be good if we run through what we should expect in the conference in the next coming days. Tina, over to you.
Can I just jump in again a little bit to say something about the resources to support safe school reopening just in a minute? So colleagues on the call, I just wanted to remind ourselves that we have several resources developed by different organizations, including UNICEF and the WINS network. So one of them is the framework for safe school reopening, which includes activities, a set of activities for prayer to reopening, during reopening, as well as after reopening schools. And it includes it includes policies and financing as important factors to ensure that the required services and preparedness are in place before, during, and after school reopening. We also have a supplement that was developed early this year, which actually targets recovery actions in the education sector to ensure that children can return to school and that they can receive a comprehensive support from different organizations and governments, of course. And then we have the key messages and actions for COVID-19 prevention and control in schools, which outlines actions for teachers, students, and pupils, as well as parents and communities. And we have a host of different publications by the WINS network, and you can see this on the WASH in Schools website, but also on Nyama Community of Practice. We have the JMP report, which I spoke about earlier, as well as publications that we even published before COVID-19, which remain essential to support safe school reopening. With that,
Yeah.
I hand back to you, Farai. Thank you.
Thank you, Irene. I'll just jump in here as we are running sort of out of time in this session. And I just wanted to let everybody know that what Irene has been highlighting in terms of the WINS network, but also the SFDs have been mentioned and the Susanna network. All these links have been posted in the chat. So if you want to get further information on these specific networks, you can just access the chat and on Passable. And just a reminder to everyone who missed maybe one or two of the sessions we just mentioned today, you can access all these sessions again and review them by clicking on the agenda items. And in future, they should be available on YouTube. I think my main takeaway today is that the interlinkages that we've been praising and talking about in the WASH sector for many, many years are extremely important. And we can see that we need to bring in health experts to teach us WASH experts about health issues that are related to our sector. And obviously, anyone in the education sector is a key person to us when we talk about WASH in institutions and WASH in schools. And conferences like UNC enable us to get in touch with colleagues of other sectors, but we also need to probably make even more efforts to do that in the countries and in the projects we work in. That would be my takeaway. Farai, would you like to close this late early show? From my end, thank you very much, everyone joining us today.
Yes, from my side, I would like to thank everyone who has attended this late early show in different parts of the world. Some are actually sleeping at this time, so it's great to have the number of participants that are on the call, but those who are also going to watch us on YouTube on demand later on. Thanking also the panelists who have really started to stimulate just the beginning of a dialogue, which as WASH practitioners, we are going to continue taking through, thanking them also for sharing all the resources that are available that we can all tap into and make use of. Thank you very much also to UNC for this opportunity for us to have this conversation. Thank you very much, and we see you next time. Have a good day.
Thank you so much.